Hello everybody, in this video we will see a very important question in child health nursing, which is explain the physiological difference between adult and a child. Then as an introduction you can see here there are many differences between children and adult like physiological, anatomical, cognitive, social and emotional. These all impact on the way illness and disease present in children and young people as well as the way healthcare is provided. Then on the basic anatomical and physiological difference, child has a very large head comparing to his body. In adults, the head is not heavier than that of the body. Child has thinner skin and adult has not that thin skin. Then rapid division of cells occur in children and in adults normal cell division. Then in children no tears or tear gland will not be working in early infancy. Infancy means till the birth to 1 year of the age, and there is a tear formation in adults. Then there will be no voluntary control over the environment or activities, and in adults there will be voluntary control on the body. Then this is view of the body system, which we will focus when we are comparing the adult and the child. That is lymphoid, immune system, integumentary, respiratory, heart and circulatory system, hematologic system, that is blood, then urinary system, gastrointestinal system, neurologic system, musculoskeletal system, reproductive system and endocrine system. So let's move towards our first system, that is integumentary system. Children, apocrine sweat glands are smaller and non-functional from the birth to preschooler years. Preschooler means 3 to 5 years. Till that time, the apocrine sweat glands will not be functioning in a child, but it will be very much functional in adults. Then the skin problems like Linnaeus disease, scleroderma neonatum, tinea capitis, tinea pedis are all present in childhood, but it will be disappearing and it won't be present in adulthood. Then moving towards our next system, that is respiratory system, one of the very important system. Child has respiratory rate of 30 to 60 breath per minute, and in adults it is 16 to 20 breath per minute. Heart rate of a child is 100 or 120 to 160 breath per minute, and in adult it is 60 to 80. Then tissue of the respiratory tract are delicate and do not produce sufficient mucus, but there is sufficient amount of mucus production in adults. No protection from invasion of infectious microorganisms. There will be protection from invasion of infectious microorganisms. Guys, if you are not writing this down, it will be very helpful if you write it as I'm showing all this. Then our next is circulatory system, adult circulation and fetal circulation. This is again very important topic, adult circulation. The artery carries oxygenated blood away from the heart, but in fetal circulation the arteries will carry non-oxygenated blood away from the fetal heart. Then veins will carry non-oxygenated blood towards the heart in adults, and it will carry oxygenated blood to the heart in fetal. Then exchange of gases takes place in the lungs, and exchange of gases in the fetus that will take place with the help of placenta. Let me make it very clear. This is before birth, that is, this is fetal circulation. Okay, that's why they are mentioning here the respiration will take place through placenta. Pressure increases on the left side of the heart in adult, and pressure will increase on right side of the heart in fetus. Then our next system is hematologic system, that will be regarding blood. Newborn RBCs are microcytic and adult RBCs are macrocytic. Size will be less than 80 and size will be more than 100 in adults. Lifespan of RBC are 60 to 90 days in children and lifespan of RBCs are 100 to 120 days in adult. Blood volume in neonate, that is again from birth to 1 month of the age, that is neonate or newborn also you can call, it will be 85 milliliter per kg of body weight, and again in adult it will be 60 to 70 milliliter per kg of body weight. Then moving towards urinary system. Infants or the children have very immature or reduced ability to filter and concentrate urine, and in adults kidney are mature enough for proper functioning. Nephron, which is the smallest unit of urinary system, that is kidney, is not fully grown and do not function fully in children, and nephrons are properly functioning in adults. In children, they do not have voluntary control over their micturition, that is urination, and in adults there will be voluntary control. Next we have gastrointestinal system. In children, cardiac sphincter is relaxed physiologically and which result in frequent regurgitation and vomiting during infancy. But in adults, this cardiac sphincter is fairly tight in adults. Involuntary control is there in children, that means they don't have any control over their passing of bowel, and in adults there will be voluntary control. And loose stool in children and hard stool in adults. Liver size of the child will be 4% of the body weight, and liver size in adult will be 12 to 13 times bigger than that of the birth time of the liver. Okay, so next will be endocrine system. In children, endocrine glands which secrete hormones are less developed at birth and it are properly developed in adult. Hemostatic control is lacking till the age of 12 to 18 months. This is very important point. Hemostatic control will not be present till they are 1.5 years. Then mature and proper hemostatic control will be present in an adult. Okay, then our last, reproductive system. Generally in girls, ovaries will be 10 mm in length and 2 to 4 mm in width at the birth, and functioning of the ovaries start at the age of 12 to 13 years of the age. And boys, testis in the male at the birth are 1.5 to 2 cm long and 0.7 to 1 cm wide. Size of the testis increase gradually and reaches maturity between 13 to 12 years of the age. So guys, that was all in this video. One of the very important topic I have covered. If it was very or little also, if it was helpful, please like, do subscribe and share. Thank you so much.